Levothyroxine is the most prescribed thyroid drug in America, and it has never fixed a single thyroid gland. After treating 15,000 patients, I know exactly why, and by the end of this video, so will you. I'll show you why the most popular thyroid test tells you almost nothing about what's actually wrong, what your medication cannot touch no matter how high the dose goes, and the blood work you need to finally get the real answer. Most people on thyroid medication believe the same thing. You go to the doctor feeling exhausted, cold, gaining weight, losing hair. They check your thyroid, hand you a prescription, and tell you this will help. So you take it every morning and you wait to feel better. That belief made sense. The system around it is enormous, and the people inside it they're not bad doctors. They learned a model and they followed it. But here is where it falls apart. Your doctor measured something called TSH to decide you needed that prescription. TSH is not a thyroid hormone. It is a signal your brain sends to your thyroid telling it to produce more hormone. Checking TSH, thyroid stimulating hormone, to evaluate your thyroid is like checking to see if someone called the fire department to tell whether the house is still on fire. The fire department being called tells you someone noticed smoke. It says nothing about whether the fire is out. On medication, the TSH number often improves, but the person still cannot get out of bed before noon, still cannot lose weight, and still loses fistfuls of hair in the shower. Your medication was designed to change a number on a lab report. And while that number was getting better, your body was still falling apart. So what is the medication actually doing? Here's what I consistently see. A patient comes in who has been on levothyroxine for 5, 10, sometimes 20 years. Their TSH looks fine, their doctor is satisfied, and they feel absolutely terrible. The medication did exactly what it was designed to do. It replaced a hormone. Levothyroxine is T4. Your thyroid produces T4. When your prescription hits your bloodstream, your T4 level goes up and your TSH comes down. The doctor sees that and calls it a win. So the question nobody asked is whether your body can actually convert that hormone into the form your cells use. T4 is not the hormone your body runs on. Your thyroid makes T4 and your body is supposed to convert it into T3, which is the active form, the one that actually gets into your cells and does something. Here is how I explain it. Imagine all the kids are lined up at the curb, backpacks on, ready to go to camp. Everything looks great from the outside, but the bus never shows up. That is what is happening inside a lot of people on levothyroxine. The T4 is there, the conversion is broken. And every marker your doctor looks at says everything is fine because nobody checked whether the bus showed up. Roughly half the patients who come to me on levothyroxine cannot make that conversion properly. They have been on this medication for years, their TSH looks acceptable, and they still feel absolutely terrible because the hormone their cells actually need is not getting there. And underneath all of that is the thing nobody told you about your diagnosis. Over 80% of people with hypothyroidism actually have Hashimoto. Hashimoto's is not a thyroid disease. It is an autoimmune condition where your immune system is attacking your own thyroid tissue every single day. The medication replaces the hormone the gland can no longer make, but the attack keeps going. The bus analogy still applies, except now someone is also dismantling the bus while the kids are waiting to board. You may have been replacing a hormone while the disease underneath it runs completely untreated. How do you know if this has been happening to you? Ask yourself these right now. Have you been on levothyroxine for 2, 5, maybe even 10 years, and your doctor keeps telling you your levels are fine, but you're still exhausted, you're still losing your hair, you still can't lose weight no matter what you do, and you cannot figure out why? Has your dose been adjusted more than once? Maybe it went up, maybe it went down, and each time your doctor seemed satisfied with the number, but you walked out feeling exactly the same as when you walked in. Has nobody ever mentioned Hashimoto's to you? Or if they did, they said it like it was just another word for thyroid problem and handed you the same prescription anyway. Have you never had your free T3 tested? Have you never had your thyroid antibodies tested? Have your symptoms got significantly worse after you had a baby, or after a period of extreme stress, or after a virus that you never quite recovered from? If you're nodding at most of those, here's what that means. The disease that started this was never identified. The medication you are taking was designed for a different problem than the one you actually have. Here's what your care should have looked like. So if this is the first time anyone has explained your thyroid this way, subscribe and stay close to this channel. Every week we go through the specific blood work, the patterns, and the root causes that conventional medicine is not trained to look for. This is what functional medicine actually looks like when it is done right. Hashimoto's is an autoimmune disease and it requires an autoimmune investigation, not a hormone prescription. That changes everything about what your next appointment should look like. The question your doctor has been answering is, how much T4 does this person need? That question that actually matters is, why is this person's immune system attacking their own thyroid and what is driving that attack? Those are completely different questions. The first one leads to a prescription and a retest in 3 months. The second one leads to an investigation. We look at gut function because the autoimmune trigger in most Hashimoto's cases actually traces back to the gut. We look at ferritin because low iron disrupts T4 to T3 conversion and creates a loop where the thyroid medication hormone never fully works. We look at vitamin D, inflammation markers, full thyroid panel, including free T3, reverse T3, TPO antibodies, thyroglobulin antibodies. That is the map of what is actually happening. I had a patient a few years ago in Texas. He'd been on thyroid medication for years. Hashimoto's the whole time, destroying his thyroid tissue, never treated. We sent him for an ultrasound. An ultrasound technician is doing her job, moving the wand around, and she stops and looks at him and says, "Where's your thyroid?" And he says, "I do not know. You are the one doing the ultrasound." And she says, "I can't find it. Did you have it removed?" And he did not have it removed. His immune system ate it. Years of an autoimmune attack that nobody ever tried to stop because the medication was handling the number, and the number was all anyone was looking at. That is what happens when you treat the surface level hormone and ignore the root cause. The dose was never the problem. The disease was the problem, and nobody went looking for it. Here is the first move you make tonight. The time is now to start demanding an answer for why your immune system is doing what it's doing. That is a completely different conversation from what you've had done before with your doctor. So tonight's test, write down these exact words before your next appointment, what to say. I want to make sure we have run a complete thyroid panel, including free T3, reverse T3, TPO antibodies, thyroglobulin antibodies. I also want to know whether I have Hashimoto's. So here's the question. If I do have Hashimoto's, what are we going to do to address the autoimmune component, not just the hormone levels? What a good response sounds like is a provider who will immediately engage with the autoimmune question and discuss gut health, inflammation, conversion markers, gluten, all of this as part of the picture. If your provider says no or gets defensive, check out the description below this video for our link and I'll happily have that root cause conversation with you. You were not crazy. You were not lazy. You were being treated for the wrong thing. Your thyroid medication was always doing exactly what it was designed to do. The problem is it wasn't designed to fix the actual problem. Now you know why. If you want to know exactly the problem with your normal labs and what to look for instead, watch this next.